Thank you, sir.
That segment.
Good afternoon, everyone. I'm Dr. Ankeeta Thali, and I'm here to present Teleconsultation, Ophthalmology Reaching Every Nook and Corner. So teleconsultation refers to the use of technology to deliver healthcare remotely. Ophthalmology is a technologically forward branch. The first project in teleophthalmology was published in 1975, and of course it played a major role during the COVID-19 pandemic. The aim of our study was to analyze the impact of teleconsultation in India's rural community. Subjects and methods. So first we talk about the teleconsultation units, which are set up in rural communities, which we refer to as vision centers, each one catering to a population of about 20,000 to 50,000. Each vision center is equipped with modalities for slit lamp and fundus photos, shiots, tonometers, trial sets, retinoscopes, and optometrists, and a good network for communication. We also have sphygmomanometers, glucometers, electronic medical records, and an optical shop. So the optometrist basically takes the history, does the examination, takes the slit lamp photos, fundus photos, and sends them to the doctor at the base hospital. The base hospital setup consists of an exclusive room which is equipped with 2 computers and a good network connectivity. At a time, there are 2 ophthalmologists and 2 staff nurses. The teleconsultation is then carried out using Skype and Remedio app. So basically, the video consultation is done with the help of Skype, and the data, that is the images, is viewed with the help of the Remedio app. So a systematic retrospective analysis was done over a period of 18 months from April 2022 to September 2023 on data which was obtained from 41 such vision centers of 10 of our hospitals spread across 9 states in the country. As you can see, this is the image of all of our vision centers in the country except for Coimbatore, because Coimbatore alone has 17 vision centers. So the data included the number of patients that were examined, treated, and referred to the base hospital, the demographic profile of these patients, what conditions were being treated, and the number of cataract surgeries that were performed. The results that we found were total patients that were examined were 1,91,194 with an average of about 10,366 per month. Maximum number of patients was seen at Coimbatore, about 44.78%, but then again, this is due to the maximum number of vision centers. The demographic profile of these patients showed that most of our patients were females and more than 60 years of age. And the visual acuity of most of the patients was between 6/60 and 3/60, that is, they had severe visual impairment. Presenting symptoms, the most common one was diminution of vision, and the most common diagnosis that we had were lens-related pathologies. But then again, like any other patient, patient would come with more than one presenting complaint and more than one diagnosis. Discussion, Born et al. In 2020 found that with a population of 1,380 million, India has 270 million people living with vision loss, and out of which 9.2 million were blind. In developed countries, the average ophthalmologist to population ratio is about 39 per million, whereas in India, it is only 15 per million. Within the country itself, urban areas have got one ophthalmologist for every 10,000 population, whereas in rural areas, there is only one for 250,000 people. Therefore, teleconsultation can help to bridge this gap. Also, we found that females were more than males. We have previous studies similar to Sabharwal et al. Also. This could be due to inability to travel the long distances to the hospital, and also due to social responsibilities of the females. Also, more patients were more than 60 years of age and those with severe visual impairment. Again, it could be due to increase in the lifespan of the population and also difficulty in traveling to far off distances by such ailing patients. We found that 37,713 patients had cataract and were advised cataract surgery. Out of these, 62% patients were below poverty line and underwent cataract surgery completely free of cost. 65,425 patients were given medication with the help of teleconsultation, and on follow-up were found to have resolution of symptoms. And almost 31,000 patients had a refractive error and were given spectacles. With all of this, it is very clear to us that teleconsultation can indeed help to reduce the burden on the healthcare system. Posterior segment pathologies, of course, it helps in early diagnosis, referral, and treatment. There have been studies also proving this, that teleconsultation can help in early diagnosis. Similarly, even for glaucoma, which is an irreversible cause of blindness, there have been studies that have been showing teleconsultation can help in early diagnosis in glaucoma and referral to the hospital. But then again, we cannot overlook the limitations, the most important one being cost effectiveness. Obviously, to initially set up the vision center takes a lot of money, but we need to not forget the long-term benefit that we get from it. Poor network connectivity in rural areas is another limiting factor. And of course, there are certain conditions which cannot be diagnosed by teleconsultation alone. But then again, we have to see the benefits. It is beneficial to both ophthalmologists and patients, and aids in case-based reference. Most studies have shown high satisfaction patients among ophthalmologists as well as patients. It improves public awareness, improves health-seeking behavior, and the post-operative care and follow-up can also be done. To conclude, teleophthalmology serves as a good eye care delivery channel. It provides preventative, curative, and promotive eye care services in a sustainable way. No doubt, it was a major source of healthcare delivery during the COVID-19 pandemic. However, even now, during the post-COVID-19 pandemic era, it is here to stay. Thank you.
Thank you, Dr. Ankeeta.
Thank you, sir.
You will all agree that teleophthalmology was of a great help to us during the COVID and immediate post-COVID period. Thank you.